Hello, I'm Dr. Dennis McKenna, and I'm joined today by Mr. Paul Semeka. Paul is the president and the CEO of Glens Falls Hospital. Paul, it's great to have you here.
Thank you, Dr. McKenna.
Okay,
great to be here.
Very good. All right, so Paul, periodically we invite people to come in here and brag a little bit, talk about what they do, talk about their role in the health system. Today you're here talking about yourself and Glens Falls Hospital.
Sure.
And I think it's a great opportunity really for our workforce and members of the health system to learn more about you and about Glens Falls.
Great.
So let's start with you. How long have you been at Glens Falls Hospital?
I've been at Glens Falls just a little over 33 years. I started back in 1989 in the Marketing and Communications Department. I've had a number of different roles at the hospital, mostly in operations and strategy. I worked for a number of years with our community service programs, worked very closely with our cancer program and its development. Also worked extensively in developing our employed network of physician practices.
Yes.
Employment of physicians was not new to Glens Falls. Right. Frankly, we got into that world because it was the only way we could recruit physicians into some of the very rural areas. And so once we did that, we had to figure out how to partner with them in order to be successful. So I did that for a number of years. I eventually moved into the Chief Operating Officer position and then into the CEO role.
So human resources, operations, physician practice, pharmacy work.
Oh yeah.
A lot of different areas.
A lot of
made
different
you
areas.
Really in many ways the perfect candidate for the role you serve now.
Thank you, yeah.
You live in Glens Falls area, you raise your family there, you're from the community.
I am. And you know, it's a very unique community in that, a little bit different than Albany. Glens Falls is a very personal community. One of the things that makes Glens Falls Hospital unique is that we are the largest employer in the region by fourfold. The next employer is 1/4 of our size. And so in our community, when you're treated at the hospital, you're really truly being treated by friends and neighbors. And it creates a very different culture than exists in some other areas. But it also creates a huge responsibility to make sure that we're caring for people in the best possible way while maintaining their privacy and their dignity.
And I'm very familiar with the care up at Glens Falls Hospital for a couple reasons. I've observed it firsthand. Obviously, I sit in the boardroom and I hear about the quality results. I have many friends and neighbors who have sought care there and had excellent care there. But for those who don't know, let's play some word association.
Sure.
Let's pick a couple of the areas that I know you would love to brag about. And let's start with the C.R. Wood. What is C.R. Wood?
Sure, C.R. Wood. The C.R. Wood Cancer Center was named in honor for Charlie Wood. Charlie Wood was a pioneer in developing the concept of a theme park. He originally established Storytown back in the 50s as the first theme park within the country. Storytown eventually evolved into being the Great Escape. And now is part of the Six Flags network of theme parks. He was a huge supporter of the hospital for both his and his family's care, and was a significantly generous donor to the C.R. Wood Cancer Center program. The cancer program was one of the first services that I worked on when I came to the hospital, and it was a very unique concept at the time of taking medical, radiation, surgical oncology, bringing them together, along with prevention, early detection, as well as survivorship and what that looks like.
Right.
How do we work to bring resources around that patient, and understanding that when they hear the word cancer, their world changes, and we need to bring the resources around them in order to support them. Survivorship has really been the focus over the last probably 5 years.
Right.
We do a number of things to really help patients embrace their next stage of the journey. One of the things we did just this past weekend was to host the Stick It to Cancer event with the Adirondack Thunder hockey team at the Cool Insurance Arena. And it really is an opportunity for the survivors to come together, along with current cancer patients, but to really acknowledge their journey, their struggle, and their success in being able to move forth. And we raise some good money in order to continue our support of patients and the work that we do.
So that's a perfect example of a hospital in its community.
Yes.
Not only providing the care, but also outreach in the community. Talk about the Snuggery.
The Snuggery. The Snuggery was the area's first, really in the Northeast, first concept of an LDRP unit, which means that mom has the opportunity to experience labor, delivery, recovery, and postpartum all in a single room, never having to move. We bring the resources into the room to help support that delivery. It is actually just such a phenomenal experience. Each room is set up as a little mini operating theater in order to support the birth, but allows mom to really have a family-centered experience rather than needing to move in order to accommodate what's happening. We deliver well over 100 babies, 1,100 babies a year. This year will be particularly busy. We know we're expecting a bit of a baby boom in March, June, or May, June, and July.
Nice.
We're gearing up for that. But it's a great program that really looks towards a very different experience for mom during childbirth.
And I will say, when I come up to your campus, and as you know, you come here every month. I travel to Glens Falls every month. I visited and toured through both of those facilities, and they are spectacular. And the staff there are very proud of the work they do.
They are.
And
They should be.
honestly, they deliver wonderful care.
Yeah.
One of the things the Albany Med Health System is doing is it's investing in having one singular electronic medical record across the system and one ERP.
Yeah.
And when we talk about one medical record, what we're talking about is wherever care is delivered, we will have the same electronic medical record, which is something that I think the public will like. I know the providers will like it as well.
Yeah.
Clinical integration is part of that, and that's
It
something
is.
that you and I have partnered on. Can you talk about some areas where Glens Falls Hospital has done clinical integration, first with Albany Med, but also with another hospital within the health system, Saratoga Hospital?
Sure. So with Albany Med, we've really been proud to partner on some of the clinical services. Last year, we really experienced the full integration of our emergency medicine providers with the Albany Med Group. So our emergency medical providers are part of Albany Medical EM Group, which has provided great opportunity for people to go back and forth, for people to experience providing care in different settings, a very large academic emergency room, and also a busy community hospital. It has really been a relatively smooth transition and has really embraced a broader experience of care. One of the things you mentioned, the integration of the EMR systems, that's so critically important. The way we transfer information now when we send patients to Albany, which we do several times a day, is largely a manual system. We have to do better than that. We have to be able to say that we're sending a patient to Albany, or if Albany is returning a patient back to us, there is a seamless flow of information so that care can be very, very seamless. In terms of clinical integration with other providers, just this past month, we are very proud to have worked collaboratively with Saratoga Hospital to integrate one of their oncology practice locations into the Sierra Wood Cancer Center and the group of providers there. That's a tremendous opportunity for us to look at collaboratively, how do we expand our ability to provide better and deeper cancer care within the region, which is critically important. These are, frankly, practices that used to be competitors. And now it's an opportunity for us to work more collaboratively, gain from each other's skills and experiences, and look at how do we really expand the reach of what we do in the community.
And you know who benefits from that is the patient, of course.
The patients, that's what
which
it's all
is
about.
wonderful.
Yeah.
And then just to wrap it up, let's talk about non-clinical services. So certainly the public often thinks about hospitals coming together and clinical services coming together, but there's other areas in which we cooperate that actually is beneficial to the health system.
Absolutely. You know, we embraced some of those opportunities early on, first initially in purchasing, supply chain, all of those areas where traditionally we were a single buyer, if you will, going into the market and trying to really negotiate the best deals. And we did pretty well. But to now look at the power of being part of a system and how that comes together, sometimes we find out that the system has some opportunities that we don't and vice versa, but we need to be able to share and really capitalize on our collective strength. Other areas, for example, you mentioned IT. Our IT services are fully integrated within Albany Med. In fact, if you're having a problem at your computer in Albany or in Glens Falls and you pick up the phone, somebody in Albany answers and really works to make sure that problems are resolved quickly and completely.
I was on a call today with the entire IT department for the system, and I saw many of the individuals from the Glens Falls campus up there, including my good friend Brian Ferdinand, who's
He's
up
great.
there. Yeah,
He's
very
great.
good. So this is wonderful. We appreciate you spending the time with us here today, really talking about yourself, talking about Glens Falls Hospital. You are also a magnet hospital for nursing.
We are a
talk,
magnet
Talk about
hospital.
that.
Sure, that's part of a journey. It actually was a 7-year journey that we set out our sites to really become a magnet organization, which really looks at nurses working collaboratively with physicians to really partner for the development of care. It does give nursing a broader voice into the care setting. But out of that has really come, even beyond that, just a great appreciation for each other in the care process and how they can work collaboratively. Just absolutely dozens of examples of how that has actually helped to improve the care that we provide. It was an interesting experience for us. We actually went through the magnet survey for the first time in the middle of COVID.
Right.
It was virtual. There was a computer with a surveyor that we wheeled around the entire organization, but they got to see and to experience the care that we provide. When really highlighted some of the things that we do that were really great and best practice of what they've seen. We continue on our magnet journey. We are now working towards our next recertification and really truly appreciating the benefits of what that means. So very proud of that.
You
Absolutely.
should be. I sat in on that survey
Yeah.
from the magnet surveyors when they came in, and they were extremely complimentary
Yeah.
of your
It was
whole
great. It was a
workforce,
good
and in
day.
particular nursing.
Yeah.
Well, if we had more time, I'm sure we could talk about a lot more. We'll have
Great.
you back again.
Super.
We appreciate everything you're doing,
Thank
and
you.
Glens Falls Hospital is in the system serving their community, which is a very large area for sure. Paul, thanks for being here.
Thank you.
All right. We'll be back again. We ask that you once again please take care of yourself, take care of each other. We'll see you next time.